we have 5 minutes left for questions, so I think that the organizers will also allow us to spend some more minutes, because we do have very interesting questions that came from the audience. And I would maybe share each question to each of you, so that we make this more balanced. But if someone wants to come in, do feel free and share your perspective as well very quickly, so that we can try to address all the questions. So the first question is related with how these tools impact the clinical workflow. Does it take more time? How do clinicians respond? And so maybe I could defer this question to Helene, if you may, from your experience both at the clinical and research level. How does the practice meet with you?
I can do that, Hugo, but I think Miguel, as being a clinician, I'm mostly a researcher.
Okay.
I know a lot about the research literature, but I think he can provide first-hand experience. So please, Miguel.
So, Miguel, please.
My experience is that the consultation gets very much more focused, and time seems to be more productive, and I think it's also easier. I find, and I don't know very well why, but timekeeping is also better. People don't tend to get late to video consultation appointments, and so I find that consultations generally, they take less time, they're more focused, and yeah, and people don't waste time or money with transportation, with parking. In the public sector, the hospital where I work, some people, they are unable to attend appointments if they have to pay for public transport even. So yeah, that's just to cover the side of and the video consultation, but there's a lot more to remote patient monitoring, which I think if you get I mean, you have to be careful about it. We don't want this to replace the contact between patients and clinicians, but obviously getting that input of data coming in between appointments that can draw attention to a patient's relapse. For example, if you get high scores for some questionnaires or some items of questionnaires, I find that your clinical activity can become sharper and more attuned to where the needs are, and that has occurred to us even in our pilot tests, that we felt we had to call patients in for an assessment after we saw their scores that they were in the questionnaires they were filling in their mobile app, and this worked, I think, quite nicely in terms of providing good care to this. I'm thinking of this particular subject now. So yeah, I'm not sure if I answered the question, but
okay. So
if I may add to that, I really think in terms of where we are heading to, also with the application of this kind of tools or decision support tool or patient, physician or therapist interaction, that it will be really in blended formats. So I really think combining the best of different worlds, like augmented reality, virtual reality, face-to-face consultation, internet-based modules, mobile application. I really think, and that in a personalized manner. I don't only think, it's also what we know about research. I think that will be really, how you say, the biggest challenge also from a clinical perspective. And the good thing what COVID has brought us in a way is that many psychiatrists and psychotherapists perceive now the advantages of video consultation, although we need much more research to show that's effective, but also that it is good, it's possible to build up a good therapeutic and working alliance also through digital communication channels, so to say.
Very well. So maybe we will just take one last question before we wrap up, and I would maybe share this question between Niels' team and João, because of their experience also in the interface between the technology and the clinicians. And the question is, how do we encourage clinicians to think about using these technologies without being overwhelmed with all the information, with all the novelty of systems that need to pair with the phone and that have very advanced technological features? So if you could briefly state some words on how to address this usability aspect or technology transfer aspect, it would be great. So maybe Niels, João, team, either of you wants to?
Yeah, thanks. I can maybe just start and talk a bit of my experience. So I think what is really important, but right from the beginning, when you introduce these kind of systems, is just to introduce the clinical team from the very beginning in all kind of steps. You know, during the implementation of these systems, you have to talk to them, you have to explain them how this is working. Also in terms of data security. I mean, if the clinical team won't trust your application on the data security issues, you can't expect the patients to trust the application. So I think this is really, really important. And then, I mean, later on, of course, you have to, I think, gain or have some of those assessments on the acceptability also in terms of the clinical acceptability from the physicians. And I think we're really lacking studies on this. So I think this is something that we have to deliver in the next couple of years. We have to develop these kind of clinical decision support systems. And I think that clinical members, physicians have to be included in these efforts. If you don't do that, they won't be used and then it won't work. But I think in general, my opinion is, I mean, I've shown you the data from our lab, 70% of all of our staff actually use these kind of digital documentation forms. I think this is kind of a high rate if we consider that actually we did not a lot of teaching on this kind of stuff. So I think that people are prone to using this.
Okay, so I think Rachel is kindly showing us that we need to wrap up. So I don't know if João or team wants also to share some of their thoughts. Otherwise, we can.
I totally agree with Niels, of course, but I'm going deep. I think this application needs to be developed together with the clinical staff, and my long experience on collaboration with the medical staff tells me that in that case you probably have completely engagement in both teams, and that's good. Okay.
Perfect. So thank you everyone again for the very interesting discussion, for the very interesting talks. I hope that we can continue discussing this theme for many years to come. And thanks again for the organization, for the opportunity, and hope to see you again soon.